Thank you, everyone, for hopping in on a Saturday morning. I love these opportunities to catch up, share out what's going on in Lansing firsthand, but also to hear questions and answers. I just wanted to take an opportunity to introduce some important people in the office and working hard for House District 28. I won't make them turn on their camera on a Saturday morning first thing, but I have my newest addition, who is Renee Watson, and she is our Community Service Constituent Services Director. She's been hard at work since the beginning of January. She brings a background in social work and experience on school board, which rounds off my priorities. And you may have already started receiving responses from her. Thank you, Renee. Also, an intern who has been working so hard in our office, Nathan Shermer, is a MSU student who has already been at work for almost 6 months and has been serving remotely throughout COVID, and now has the opportunity to come in and work in our office. So I want to thank him because we do not pay our interns enough, and I wish we could, but I hope it's a good experience that helps guide him on his path in public service into the future.
It certainly has. Hi, everyone. I'm intern Nathan. Sorry I look like this. It's Saturday morning, but I'm happy to be here. So thank you, Revstone.
Thank you. It is the first month of the 101st state legislature, and I want to thank everyone who is responsible for returning me to serve for another term, another 2 years. I've already been busy, and we haven't even had a committee meeting yet. I will be serving on education policy, health policy, and insurance committees this term. I'm excited to return to the work I've started on education and health policy. And I've done a lot of work group around issues of auto insurance reform. And so to be able to sit on that committee and weigh in firsthand is a tremendous honor. And we continue to serve. We've served over 1,600 people with unemployment assistance during the last term, as well as a lot of questions around COVID and other issues, everything from how to get a Secretary of State appointment during COVID. So reach out. If we can't help you directly, we will help put you in touch with the people who can. And a lot of people don't know what to come to your state representative for. So we can help navigate state agencies and departments that can be very difficult to navigate during the bureaucracy. So if you're reaching out for assistance from a state department and you're getting stuck, call me, email me, reach out, and we will help you find a path to get your answers and get assistance. Also, if you're not sure who or where to reach out to us. If it's a local issue, a county issue, or even a federal issue that we don't handle, we will make sure that it gets into the hands of the correct level of government to help you out. Let's jump off here. I'll give you a brief overview of what's happening in Lansing, and then I'll open the floor to questions and concerns. Let me start with COVID. So overwhelmingly, COVID is one of the top constituent concerns everyone is reaching out about, specifically vaccinations. But let me back up and make sure including restrictions on restaurants. Dine-in options are available for opening to 25% of the dine-in capacity of a restaurant. As that is open, everyone has their own comfort level, and some people are already vaccinated and eager to get out there. And I encourage you to participate. But I do want to caution, from what I've learned from our public health administration, that participating in the community unmasked is one of the biggest risks for COVID transmission. And you are unmasked when you are dining. You can only eat with your mask off. I continue to support our local restaurants with carryout, and we want to keep them in business. We want them to, weather the storm and be there as the community opens up. I want you to make informed decisions. A lot of times people consider, once these restrictions are off, there is no risk. And all these decisions, whether they're increased restrictions or decreased restrictions, are in direct relation to how much COVID is in the community and in the state. And every choice we make to go out and interact and how we interact is a response to, your response to potential exposure and transmission. I appreciate that. So we want to be responsible and keep that in mind. So as for numbers, our state numbers have come down, and by November, our numbers had come up from this summer, where it was the lowest, to practically 5 times, 500% of where we were when COVID was most managed. We are down to probably about double. So we have not brought our numbers down to where it was when it's lowest. In Macomb County, we're still at about 8.3% in January, which is still pretty high transmission rates. We would like to get those numbers below 3%. That's our goal. And anything you can do to help will make a big difference. And one of the things you can do to help is vaccinations. And I know many people are eagerly waiting the opportunity for a vaccination. We know that with most vaccinations, it increases your body's ability to recognize a foreign entity, a virus, and fight back and offer protection. Macomb County has received 21,175 doses of COVID vaccines. And that is through the county health department. They have either administered or have appointments to administer all of those. And every week they get new doses. I believe it's usually Tuesday of the week. They know and they open up those appointments. So keep that in mind. Tuesday seems to be the day that they're distributed. However, on an MDHHS, Michigan Department of Health and Human Services call update I had yesterday, they explained that where the nation and the state was on a week-to-week distribution model, we now have a 3-week projection of where vaccines are going to be, how much. And remember, they have to manage first doses as well as second doses. So as those doses are distributed, they need to keep in mind they have to have enough for you to come back, and 3 to 4 weeks, depending on what you're being administered. There are 3 paths to administering vaccines. One is our health hospital systems. They were the first people getting vaccines, and for the primary purpose of distributing it to healthcare workers. And, most of those health workers have at least had the opportunity to get that administered. And now they're expanding to distribute to patients who are eligible. Second is our federal pharmacy partners, Walgreens and CVS, as well as state vaccine partner Meijer. And those will be growing as well. Their primary focus has been distributing to nursing homes, assisted living facilities, congregate care facilities. And the third path is through the health department, the county health departments. And keep in mind, there's 83 counties with different health departments, and they each have their own procedure for rolling it out. So here in Metro Detroit, we're hearing, this is what Oakland County is doing, this is what Wayne County is doing, and we're watching how Macomb County is also distributing. the goal is that at least 70%, 7 out of every 10 adults will get this vaccine, because that will help suppress and not give COVID hosts to multiply and transmit through. 90% of doses that are received by a health department or any of these distribution partners are expected to be administered within 7 days. So there aren't big stockpiles of this sitting anywhere. They're coming from Pfizer, from Moderna, directly to health departments and distributors. And those are being mostly appointments and then administered. And the state is also trying to be very purposeful and intentional about distribution. So geographic, making sure every county in the state, whether you're in the UP, Northern Lower, or Metro Detroit, is getting vaccines to distribute. Making sure that we're accounting for disparity by populations. So we know Metro Detroit was hit hardest up front, and we want to make sure those communities are also getting vaccine to prevent further spread. So we are in the second wave of rollout, and a lot of frustration is about there are more people eligible for vaccines than there are vaccines. So we know supply and demand was always going to be an issue. We cannot wait to have those protections that allow us to resume life more normally. But again, the state is trying to balance who gets it first by who is most vulnerable and most likely to get most severe outcomes, hospitalization and possible death from contracting COVID, and then also making sure that we have our essential infrastructure in place. So that's when you have healthcare workers, first responders, and then getting into educators and different essential workers, making sure that those services can function. The next wave should be, it's probably going to be a wait before those expand, because we still have quite a few people in that second wave who are eligible who have not received it. So before they open it up to more eligibility, they want to make sure they can cover as many people in that second wave as possible. So MDHHS is well aware of a lot of the frustrations, difficulty making appointments, difficulty, the amount of vaccines, where they're getting distributed, and they are working with the Biden administration to create a more comprehensive plan to push it out, make sure it's available within 20 minutes of where you live, make sure that there is the manpower to distribute it in force, so that we're not waiting on, if the doses are ready, they're in people's arms as quickly as possible. And that's the thumbnail update on vaccination. Variations. So every time we think we know what's going on and we've got this managed, there's got to be another wrench thrown in it. So, we get the first wave under control, we have a nice summer, and the second wave comes along. And then we start to, we restrict our choices, and thank you to everyone who, made really responsible choices around the holidays so that we would have more holidays to celebrate together. We were able to manage our numbers compared to surrounding states, and that makes a difference. But now the latest wrench is variations. So from what I've understood, there could be up to 3 variations on and mutations on a virus a week during this. So the longer the virus is out there, the more potential for mutations there are. Now, not all mutations are more transmissible or more higher mortality rates. Some of them just are mutations and they really don't affect things. But as they watch and as they, type the virus, we know that UK, Brazil, South African variations are more transmissible, and they have all been identified in the United States, and the UK variant has been identified in Washtenaw County in Michigan. But we know that community spread is happening of these 3 variants, and while they're not more deadly inherently, the more they spread, the more people that get them, the more hospitalizations that can occur, and by virtue of that, the more deaths that can occur. So the Health Administration is watching carefully for the impact of these variants on our numbers. The more transmissible it is, and the more relaxed people are with their, social behaviors, the greater potential that we could see another spike. So keep that in mind. A lot of people are looking for a finish line. What is the number that's going to make us safe? What's going to make it, that we're back to normal? And it's kind of like a whack-a-mole game. We're constantly looking for, okay, what do we need to change to improve our outcomes? What do we need to do to bring it down and try to prevent community transmissions? And right now, getting vaccinations pushed out is one of the best ways to just kind of dampen that. I just want to give a little preview of what I'm working on as far as legislation. I'm glad to take some of the bills from last term and be able to get those out and rolling right off the bat. I was very proud to have 2 public acts signed into law, including a criminal justice reform on driver's license. In my first term, there's some reps that, you can go 3 terms and not have a successful public act. And so I really am celebrating that. Right now, I'm working on educational fixes to get us through the school year in regards to COVID fixes. So we know education has not looked like it has traditionally. We know that there's been a lot of learning loss. We know that in spite of all our school districts and our teachers' best efforts, that there's been learning loss. And so there's 2 things in laws there's several things in law that we have to do to get federal dollars. And one of them is standardized testing. That would be like the MSTEP, the Michigan Merit Exam, the PSAT, in order to get that funding. And a lot of professionals, whether it's superintendents, principals, school boards, and teachers, recognize that spending weeks and money and resources on standardized testing to tell us our students have had learning loss is kind of a waste this year. And we've got local tests, benchmark tests to show us where our kids are struggling. And so one of the bills I have is a waiver request that would allow schools to waive standardized testing this year. Another piece that we're working on is teacher evaluations. So often a big chunk of their evaluations, administrators' evaluations, based on these test results. And we can revisit the value of that at a later date, but we want to give, again, school districts flexibility and to empower the teachers to spend as much time with their students between, now and the end of the school year, and take some of that burden off of them. I'm reintroducing my piece on Liam's Law, which is increasing accessibility for people with disabilities. When we have young children and babies, we have diaper changing stations in public facilities. But, since ADA passed back in the 90s, there hasn't been big pushes forwards for accessibility and inclusion in our community. And Liam's Law would create a requirement that large facilities, like a Detroit Zoo or like a Little Caesars Arena, provide a bathroom facility that includes an adult size, adjustable height, changing table. That means that people with disabilities have the same opportunity to enjoy entertainment, education, and outings with their families. And so I'll be working on that. More work around educational funding, some work on making sure that work facilities are available for women on construction sites. And you know what? We're always adding to our list of ideas with problems and suggestions that constituents bring us. So feel free to reach out at any time with more ideas. The last shout out I have before I open up the floor is a project that I'm working on for February, which is a diversity toy drive. And this is to benefit Royal Oak Children's Hospital, child life specialists. So they provide entertainment, education, and social emotional support for children in the hospital. And they identified that they would like to include more diversity in the toys, games, books, and dolls that they have to offer their patients. So their patients look like our community, and they want to make sure that they have something to offer all children that is representative of the community. So I'm so proud to partner with the official Democratic Black Caucus of Macomb County and Femmes for Dems. In this effort, we're going to hear more and more about it over the next 28 days. Warren City Hall on the 3rd floor near the treasurer's office will be one drop box. Centerline City Hall lobby will have a drop box. And Plumbers Local 98 in Madison Heights is hosting a drop box. So more information will follow. But I'd like to ask if anyone is interested in helping. We will also be putting together a wish list of books and culturally diverse toys that we can reach out and provide for the children at Royal Oak Beaumont. And with that, if you'd like, you can either raise your hand. You go down to the bottom of your screen, the reactions, and there is a raise hand function. You can unmute your microphone and share. I just ask everybody, be respectful, be polite, take turns, and I'd love to hear from you. Who's going to kick us off?
I'll go.
I see Cheryl. Cheryl, good morning.
Good morning. Referencing what you just said, I'd be interested in volunteering in some way for the children's book driver. So
wonderful.
If you put me on your list and contact me.
Absolutely. Have you already dropped your email in the chat?
No.
If you go down to the bottom of your screen,
yeah,
there is the cartoon bubble that says chat.
Yeah.
When you click on that, you can add an email, and we'll make sure that we reach out and include you in communications. And for anyone who jumped on a little late, if you can add a name first and last and an email address, that will help us follow up with any inquiries you have, as well as invite you to further community conversations or roundtables. If you want to, you can always plug a question in there as well.
Okay, I'll just jump in from it. This is Sue. My daughter Karen is a teacher. She couldn't make the meeting today. She told me to get in. I had a heck of a time. I'm novice on this stuff, but I made it. I will pass this information. I know she likes to help, especially with reading projects and stuff like that, and see if she might be interested. So Karen Keffer can be put on your list as a possibility.
Wonderful.
Okay.
I will make a note of that.
Yeah, and of course, when she gets involved in something, she drags me along, but it works both ways.
That's fantastic. And you bringing that up, Sue, brought back a couple things that about vaccinations. So I'm hearing on Facebook about teachers looking for vaccinations, and they're really struggling. They're competing with other eligible populations to get their vaccinations. So, I've encouraged superintendents and the MISD to work on partnering with local either hospital systems, pharmacies, to help provide teachers like a one-day vaccination clinic, because like everyone else, they're competing for those few doses. And we know that we want to get kids back face to face. It's the best practice in education. Although, you know, some families will continue to elect for personal reasons a virtual education this year. But we want to provide those educators the protection of returning to school.
If I could jump in on that, Karen is a Detroit teacher, and I went with her to get her first shot, and they did a really good job. They were very well organized, and so she'll be getting her second job. So they might be an example of how to do this.
That's fantastic, Sue, and that's exactly what I'm looking at. You know, DPS, Schoolcraft College opened a vaccine clinic for special education teachers. Portage was it Portage or Kalamazoo? One of the Western school districts had created a partnership. And so I'm looking for where is this being done best, and can we bring it back here and replicate it in Macomb County?
Yeah, well, I could also mention that I got my first shot through Beaumont, and that was very well organized. So
that's fantastic to hear. And that is just another thing I wanted to put on people's radar. A lot of people are, you know, calling in to Macomb County Health Department and just frustrated with the inability to get an appointment and the persistence that they have to use. It's kind of like winning the lottery to get through, but persistence pays off. Mix it up. You know, a lot of people are hopping in at 6 a.m., 7 a.m., 8 a.m., but are finally getting through around 1 o'clock, 2 o'clock, 3 o'clock in the afternoon. So mix up your times when you try it, but also keep your options open. Hospital systems are administering doses for the general population. So either reach out to a local hospital system or the hospital system your insurance may be affiliated through. A lot of the times they have online apps where you can request an appointment, and once they have a dose, they will let you know, come on and schedule your appointment. And then also look, you know, Myers is starting. I don't know if they've started their distribution, but they're definitely creating their interaction app. Put it out there as much as possible. You know, don't limit yourself. Some places will distribute if you live there or work there. So like Karen, she was able to get it in Wayne County because even though she doesn't work or doesn't live there, she works there. Right. So consider all your options.
Yeah, well, my other daughter, Tina, is having the struggle with Macomb County right now. I'll pass that on to kids.
Please have her reach out to me, and we'll keep working to make sure that we get those distributed as effectively and efficiently as possible.
Yeah. Okay.
Lori, this is Lori Arts. What can we do, though? Right now, the city of Warren is refusing to open our libraries because the librarians cannot get vaccines. That's ridiculous. There is nothing being done in Warren to get our teachers vaccines. How can I, as an individual, get our teacher? It's ridiculous. I won the lottery. I'm getting a shot Tuesday morning. Yay.
Good.
But I should not be getting a shot before the teachers. The teachers are in there with our students and our future, and these new variants that are coming through are more infectious to our kids. We need to get our teachers vaccines. There's no reason. They had a special arrangements for the police. They had special arrangements for the fire people, and that's wonderful at EMS. They had special arrangements for the healthcare workers inside our resident care facilities. So why is Warren and Macomb County not doing anything? And I mean anything, protect our teachers. The governor says she wants the schools to open by March 1st, but I haven't seen anything coming out of the state to organize to get the teachers vaccine. You know, I can't imagine being a teacher and walking into a classroom right now. That is just ridiculous. So what can we do as individuals? I mean, I can't organize the teachers unions or Macomb County, but we really, really, really need to protect our teachers because they're taking care of our future, the kids.
Yeah.
Their teacher.
No, being a teacher, I echo those. I appreciate that, Lori, and I'm glad to have advocates who are raising that issue up as well. One of the problems of a decentralized healthcare system is that, you know, it is excellent because what, you know, a Petoskey or a Genesee County needs is different than a Macomb County or a Wayne County, and they can make those decisions locally and respond to local conditions. One of the challenges is a situation like this is not everyone is in line doing the same thing, and they're still trying to figure out best practices. I really encourage you to reach out to County Executive Mark Hackle. He works closely. He has a COVID command center with the county health department to see if we can't, you know, get some of that within the county as a priority. But again, it's difficult when you have a supply and demand. You know, who do you tell to wait? Do you tell the 75-year-old person, the 65-year-old person with a lot of health problems that are compounded? Do you tell the teacher? And so we do our best to open it up and then try to create these partnerships. So like I said, I'm going to be continuing to reach out to, you know, hospital systems, health department to see if we can't get those partnerships with teachers to at least get them some initial vaccination before that March 1st. Also, libraries. I did reach out to MDHHS. I asked what the protocol was on libraries. Most libraries throughout the state are continuing to function, perhaps with some restrictions, and find a way to adhere to social health recommendations, you know, in order to protect staff, whether it's putting up barriers, spreading things out. Unfortunately, you know, Warren has chosen not to. The librarians do not fall into the educated category. That would just create another, you know, layer of competition for those initial doses. So we, you know, I encourage people to reach out to local government, whether it's your city council, the library commission, the mayor's office, and let them know that this is an essential service. You know, we pay taxes for our libraries. We pay millages for our libraries. We have some exceptional library facilities and what they offer. And we know that in a community with high socioeconomic demand, there are a lot of households that don't have, you know, wireless access, might not have a computer in their house. They depend on their library to get tax forms to file, as well as copy machines. And so helping our community leaders understand that the library is essential, and that we can do things within our library system to protect our library staff, and we can respect that. But hopefully, whether, you know, the appointments, we find a way to get those accessible to the public. Joel, I saw your hand up next.
Thanks, Rep. Stone. First, I want to thank you for sponsoring and co-sponsoring House Bills 5846 through 5852 and 6235, you know, eliminating the license suspension for things that, you know, aren't driving related. The one thing with this vaccine thing, though, I'm wondering if you and the other, you know, state reps and even, you know, state senators could possibly, you know, talk to Mark Hackle and say, you know, is there a better way we can do this? Like what Oakland County's doing with their list system, where you sign up, you get on a list, and, you know, you might be, you know, number 20,000, but at least, you know, you're on a list. And I just think it would go a little bit better than this. I think somebody described it on Facebook as Hunger Games, like what we have right now, you know. And the other thing is this, I'd also like to see, you know, you and the other state reps and state senators perhaps go to Governor Whitmer and say, look, you want the schools to be open by March. How about we go back to 1A, roll this back a little bit, but include teachers in that. you know, and say, we're going to get all the teachers vaccinated so that we can make this happen by March 1st. And, you know, and unfortunately, the rest of us, I mean, I'm over 65. If I've got to wait, I've got to wait. But I'm willing to accept that because of the fact of what they're trying to do. And I think what happens is there's got to be some kind of compromise or some kind of something that can be worked out that will get teachers vaccinated so that, you know, they can go back into classrooms, say in March, but also some kind of orderly system, because what we have going on in Macomb County right now, I mean, it makes no sense to me. You know, I mean, I tried this last Tuesday and it was just constantly calling. And then same thing online, the system's crashing, you can't get through and everything. And from what I understand, really within about the first half hour or so, all 5,000 vaccines were done. I mean, there just wasn't anything else. And that's where I think that, you know, I understand what the governor was trying to do. But if you don't have the vaccine open up, like, okay, unless she's got David Copperfield working for her and all of a sudden he's going to magically make these vaccines happen, you know, it didn't help at this point, you know, and I'm a big supporter of hers. Like I said, I think the county can do better, but if that's possible, I'd like to see those teachers vaccinated before March 1st. And I think there's enough time to do it. But I think if the governor were to say, look, the 1B, I think it's called, is just going to have to be
M1B.
other than the teachers for right now, so we can finish that. So, but thanks for all you do. I really appreciate it.
Absolutely. And I want to ask for your help. So I am one voice in 110 House representatives. I'm one voice in 148 legislators, and I'm on calls 2 to 3 times a week with MDHHS, the executive staff, regarding COVID and updates. And I have let my voice advocating for our teachers and our schools be heard, asking for, you know, even if you can't impose this on our county, can we set best practices? Can we push in what we know to be working? And so we continue to put that pressure, but your voices matter too. So a lot of times we surrender our voices because that person who may be in a more prominent position has spoken up. So let it be heard. But it is by the more voices, we're stronger together. So this is important to you. Please reach out, make that personal ask as well. You can drop an email to the governor as well as to the county executive. And it matters. What we notice when our emails boxes are swamped with issue requests, we notice, and those become priorities. And so, you know, I use my podium as much as possible to advocate for what we need here and across the state. But I ask you also, for every ask I make, will you stand with me and send an email? I will continue to emphasize to the county, I was disappointed. I love Macomb County Health Department. They have been working. They have been on the ball. They have kept up with our numbers, our dashboards. But there are some areas they could improve, like going out and making sure that businesses were following the guidelines for COVID. We were behind the ball in Macomb County. You know, Macomb County bought an extra freezers in order to be able to accommodate the Pfizer vaccine and be able to distribute more, but they didn't have an online interface for requests. We just had a phone line, and Oakland and Wayne had theirs up and running. You know, within a couple weeks, Macomb County created that software, but again, we were behind the ball. So I have high expectations. Macomb County has a lot of, you know, we have resources, we have talent, and I'd love to see us be in front, being the leader on things instead of playing catch up too. So I bring all of my ideas to them when we meet, and I hope that they are continuing to evolve their response. And so I do expect some of those improvements, and I will hound them until they produce them. I think, is it Ani Manolatis?
Yes.
You're up.
All right, thanks. So, reporters, good to see you again. Just had a quick question for you, because last year we did an education event with 4824, and they had a couple people come out and talk about something that you mentioned earlier, which is web access and making sure everyone has computers and the technology to access at distance learning if their schools are completely distance learning. Is there anything that the legislature is trying to do right now that would be able to expand access through getting more high-speed Wi-Fi for folks who don't have it, providing computers to those who don't have it, so that way they can also, especially with that learning loss you mentioned earlier, make sure they're not falling behind in school?
That is a great question. Web access and learning loss. So COVID really shined a light on the disparity on education and access to internet. With the amount of software we have for students to support their learning, to learn that there are complete regions of Michigan that don't have access to them. And some of those regions are as close as northern Macomb County. So, north of 20 Mile, thank you, Hall Road. And that was a shock. I thought Macomb County, Tri-County area, Metro Detroit, we've got to have good coverage. The Dems have introduced bills and put it up in committee. We have not gotten the same support across the aisle. And when the majority is setting the agenda and approving committees, that's where especially organizations like 482 Forward that have large memberships and mobilizes can put that pressure. Also, public opinion and op-ed, putting it out there on social media. I know there's some petition drives to make sure that these things that are priorities should be priorities for those that lead. And we can't wait for, a change of leadership. 2 years is too long. So we continue to reintroduce those bills. I believe that with this, that hopefully the leadership, this will be a priority for them as well. My fingers are crossed. We continue to reintroduce legislation. We keep looking at it through different lenses. So is this something that, we subsidized industry to incentivize them to put up the infrastructure there? Or is it something that we regulate as a state utility? So the places that businesses find to be profitable, they've built out the infrastructure, and now it's up to the state to create the infrastructure for everywhere else. I hear from the Biden administration and kind of what they're looking at is this become the next century's civilian conservation corps? Is this the new telephone pole network that we could create a large infrastructure jobs program around and make sure that every corner of not just the state, but the country has access to internet? So it's on our radar. We have solutions. We're looking for also who else is doing this and how are they doing this? Who's doing it best? And then we're looking to put pressure on leadership to make the decisions and hopefully lead on this issue, pick up the policy and put it in place. So you can help me support me with that. And I just want to applaud our local school districts. We transitioned, we looked for our options, we looked for hybrid, virtual, and in-person options, and quickly identified families that didn't have computers and helped provide one-on-one technology, identified families that didn't have wireless access and provided hotspots. It wasn't a complete solution, but our school districts really stepped up for our students to get them what they needed to keep learning as quickly as possible. So I just want to applaud all our local districts. Keith, you're up.
Okay, let me get this. Okay, am I there, Lori?
I can hear you and
okay.
you're on.
All right, good deal. Good seeing you. And I had little issues finding how to get on here, but I finally made it, so that was good. And what got me thinking when you were talking about the diversity toy and book drive, beginning next month, I'm going to be a volunteer at the vaccine clinic at Royal Oak Beaumont. So I'd be happy to help out. Where I live, I could easily get to Warren City Hall, Center Line, and the plumbers here in Madison Heights and deliver. If you needed somebody to do that, get the toys and books over there to Royal Oak Beaumont.
I'm writing it down right now, Keith. So
yep. Okay.
I will.
I know you have my contact information as much as we've been in touch with each other. So
absolutely,
so yeah, you can get me on the hook when it's time to go.
I love it.
All right. And the whole library thing, the little side note, I go up north quite a bit. I haven't been up since I came home earlier this month. The librarians up there, they just weren't interested with that public interaction. They were having too many people coming from other places that their libraries had closed. So it was just, it was too much dynamics going on for them. So that they made it where you could come into their parking lot and use the Wi-Fi, but you couldn't access, they have computers too. But yeah, it's especially up there where I'm at, it's very rural, and a lot of families that exactly what this conversation is going around. They don't have Wi-Fi and computers. So I don't know how the kids are doing up there right now.
Yeah, no, they had to resort, a lot of them, to paper packets. And that's basically teach yourself. And hopefully your parents have a background to help facilitate that. But it's a struggle. We don't expect kids to learn on their own.
Right.
But thank you for bringing that up. Every library system is looking for what works for them, curbside delivery. But we're very fortunate in Warren. We have a lot of, study rooms, separated areas. We have some larger facilities that allow people to spread out. And I have a hard time believing that we can't be creative and create a solution that can keep our staff healthy. And, if we're opening up eateries, dine-in restaurants to eat without masks, that when people come in masked, observe social distances, put up barriers, separate into different rooms, maybe limit occupancy.
That's what they should do, especially here at the community center, that they opened it up this past month for their fitness center, which I use. So I had to call to see how it is, because it's by appointment only. And it's really working good, because there's when I've been there, no more than 6 people in the exercise room, and you're masked up, and unless you're exerting yourself, you don't have to have a mask on. So that's what I needed to know. But the library's closed, and that library is so large, you could easily do social distancing in there. And I'd like to take advantage of the library again too. I'm surprised that in the same building, they haven't opened that up yet.
Yeah. Well, and I just want to, again, encourage you. So government works on a lot of layers, and I love having these conversations and being responsive to my community. That's why I'm here to serve. And I just want to remind you, your voices matter at every level of government. So whether it's citizen comment at a city hall, city council meeting, if it's picking up the phone and reaching out to the mayor, he prides himself on his constituent relations and responses. Or dropping an email or making a call to the governor or Congress. Sometimes we feel our voices are so insignificant or so small. Who's listening to us? Mm-hmm. But I'll let you know that look around, of all the 90,000 constituents I have in my district, here we're at about 20 people this morning. And I just really encourage people, your voice matters, and they should be listening to you. And if they're not, they will hear you in the end.
Okay.
i.e. elections, vote. Christine.
Can you hear me?
I can hear you.
Good morning, everybody. So I am a constituent. I am also here today because I am an advocate for the Alzheimer's Association of Michigan. I am one of their state champions. So it is my responsibility to have conversations with people like Lori. So Lori, I just want to take a second. I want to thank you for your support last year. We pushed through more bills and more funding for Alzheimer's and dementia care than in any year prior. So I know that you've been a huge advocate for that, and you've used your role in the Health and Services division to really advocate for families like mine. So I just wanted to take a moment and say thank you for that. A tie into to COVID and the pandemic. One of my favorite activities recently has been fighting with people on Facebook who love to post things like, I would never put my loved one in a nursing home. Why would anybody do that? Well, the reason that families like mine need to utilize nursing homes is because dementia is a progressively degenerate disease that robs us of our loved ones. And the care that it takes to safely care for them, it's immense financially, emotionally, and physically. So people want to be able to take care of their loved ones in their home for as long as it is safe to do so. And hopefully for many, that means that they get to take care of their loved ones through the end of their lives. For me, that was not the case. We needed to use a nursing home facility. We've watched what's happened with COVID in the nursing homes. And I think that's pushing more people to really take a look at how can we take care of our loved ones in our homes. So one of the things last year, we spent about $1.4 billion in Medicaid on dementia and Alzheimer's alone. That's expected to increase by about 17% over the next 4 years. 1 in 9 people today over the age of 45 are experiencing memory loss. And we really need strong advocates like you to help us make sure that we have the funding and programs in place to take care of our loved ones. So I'm not sure if you know this or not, but within the Michigan Department of Health and Human Services, there is not a dedicated dementia or Alzheimer's care unit with full-time staffers. We have these for other chronic diseases, cardiovascular disease, cancer, etc. Even arthritis has a dedicated unit within MDHS, but we don't have this for Alzheimer's. So our ask this year is that we provide funding to create a dedicated unit within MDHHS for Alzheimer's care. Their role would be to oversee the state's dementia and Alzheimer's plan. And I think we've seen with COVID that having a plan of action is vital to our success in beating diseases and viruses. So one of the main roles of the full-time staff within this unit would be to oversee and update the state's dementia and Alzheimer's care plan, collaborate with state agencies to leverage resources. You mentioned earlier that part of your job is to help your constituents like us when they get bogged down in the red tape and not knowing what to do. I can't imagine how much it would have changed my caretaking journey if I'd have been able to call a specific unit or group of people and say, help, where do I find these resources? How do I deal with this? How can you help me? And today there isn't a centralized place like that for the residents of the state of Michigan. So they would be a good touch point for that, collaborating and leveraging all those resources. They would also create a public awareness campaign. About 50% of people with dementia and Alzheimer's aren't diagnosed. And a lot of families chalk that up to, grandma's just forgetting things, when it's more serious than that. And if they had the diagnosis, they would have access to treatment plans and care plans and those types of things that could help make their journey a little easier. And then the last thing that unit would be doing would be seeking federal funding that's available out there. We just don't have anybody going to get it. And the federal funding could help offset the state costs for taking care of Alzheimer's and dementia patients within the state. And doing this would help keep people out of nursing homes, which costs the state billions of dollars a year, causes families all kinds of heartache. There's a better way to do this. And I would love your support in helping to organize and fund, well, not organize, but helping to fund and make this a priority within the state.
Definitely. This is an issue that's near and dear to my heart, and it's something that I will help champion. It sounds like you have it well thought out as to what that looks like.
Yeah.
If you can share some of that language to my office, also if you know if someone is spearheading this, so I can reach out to them. Or if it's opportunity, let me know. I've worked with our local PACE organizations, which are some of these amazing, gap care that help provide relief for family caregivers. anyone who is eligible for a nursing home, but maybe not ready for a nursing home yet. It provides daytime care as well as additional help in-house with chores, home health care, a facility to go to and spend time during the day, as well as on-site medical care, physicians for appointments, and they coordinate medications as well. And so that allows family members who want to keep their family at home longer, or an individual who wants to remain independent longer, some of that care on a daily basis that allows them that. And it is a tremendous cost savings to the state. So I think we're starting to get out of the mindset that, it's a hospital or nursing home or home. And we're trying to find some of those ways that we work together. And again, COVID has really rocked what that looks like. But I'm also looking around at, who's doing it best and what kind of innovations people have gotten, not only with tele visits with family, but, the hug, being able to hug and touch and brush hair and safely through a barrier, but have some of those face-to-face meetings. And hopefully with vaccinations, we can restore that, because that was huge for health and survival.
It really impacts dementia patients more than others because they need that constant human contact and interaction and touch to keep their tenuous grasp on reality. And once that's gone, we see that these patients are deteriorating at a very fast pace. We know that death is the end result. That's what's going to happen today. We don't have survivors of dementia and Alzheimer's today. It means a progressive death. In the future, we hope that with research that there's a cure and that it is no longer a death sentence. But the nursing home situation is really disproportionately affecting the mental health of dementia patients. So I appreciate your advocacy with the vaccine and your support. I will get over some information to who's spearheading that, who at the Alzheimer's Association is really the lead on that. And then we just have like a 2-page document that's pretty easy for you to read and digest. Thank you.
Thanks for your advocacy too, Christine.
Thank you.
Well, we're winding it down. It's noon, but I don't want to cut off anyone who still has an issue to raise, a question that needs an answer, or a concern.
I just want to say thank you, Lori, for putting this on. This was helpful. I just emailed the governor, and I'm going to go down the list. Senator, do it all, because we got to get this Macomb County protected.
Absolutely. Thank you for joining, Michelle. And just one last call. I'm seeing lots of contributions to the chat, but if you haven't had the opportunity, add your first and last name and an email address, and that will allow us to invite you to future events and follow up on any of these issues. We're looking ahead to the year for, issues we want to hold town halls, informational roundtables on, in addition to community conversations, so we can bring experts and resources to the community. So if there are issues like Alzheimer's, memory care, and family caregivers that we've partnered with the Attorney General's office for preventing senior scams in the past, and making sure we bring access and information about resources to the community. Please feel free to drop those in and share them. We want your feedback to make sure we're bringing back and programming things that are important and that you care about. Ani?
Thanks again, Rep. Stone, for all the work that you do. You just brought up something that I wanted to ask you about. We were thinking of wanting to do some kind of event with you at some point over the next couple of months. So do you want me to just call or email your office?
Absolutely. Let me know what you are interested in. ACEs, Adverse Childhood Experience, is one of the things that 482 Forward is leading on, and something that impacts our community, but most people wouldn't know what it is. So we want to do an educational campaign around that. Tina?
Hi, Lori. I came in late, so I missed a lot of the beginning, and I don't know if anything was said about the unemployment. It's my understanding that started back up, but is there a difference between PUA and PUC, and which one is up and running?
Yes. So by the 30th, by today, the state is supposed to have all the federal guidelines back into the system. So they have said if you are on PUA, so that is the not traditional unemployment that state would administer. It's that safety net program for non-traditional unemployment that the federal expanded in order to make sure everybody's covered during the COVID.
Okay.
And so most of the traditional have just been carried on. Once that was reapproved, those certification tabs continued and have been applied, and they've received their back payment. But I have a lot of people reaching out with the PUA requests, and most of them we were asked, encourage them first from your MyWAM account. Let the UIA know we're not up and running. What do I have to do next? Second, they said if there's any messages about how to handle your claim, follow those step by step. And then finally, now they said give them to January 30th. And Renee will correct me if I missed something. She coordinates a lot of the UIA. She's in a lot of those meetings and makes sure that we have the latest information. So if it's changed since I've heard last, let me know, Renee. They said give them to January 30th to update the software. Hopefully you should be seeing those updated. If you don't, please reach out to my office, and that's where we can file an inquiry and ask for assistance. And this is where we make sure people don't fall through the cracks, right? We watch them and let them know we're watching. Have you solved this yet? Renee, do you want to add anything to that? Any other details that they need to know?
You pretty much said it all, Rep. Yes, January 30th is the date when the new system transitions. So look for your email communication through a UIA. They will prompt you and let you know where you're at, whether you have to recertify or not. More than likely, you will not. The only way you would have to recertify if you're moving from a different program to the next. But if you're still on PUA, you shouldn't have to certify. Everything should be good. Just monitor your email and you'll have that communication. But everything else was right on.
And help get the word out that those benefits will backdate to December 26th. So when the benefits ended, this covers everything up to then. So I know people are trying to make ends meet with bills coming due at the end of the month, but that's in the progress. You'll get caught up. Reach out to those debt holders if you need to up front. They're familiar with this. You're not alone in handling it, but those benefits will be paid out. Keith?
Yeah, one last thing now that we're talking about this. I've been monitoring it, and I've been seeing a lot of aggravation on Nextdoor, on my Nextdoor.com site, but I didn't throw your name out there because you go to, I've been explaining to them what's going on with my experience, and yeah, pretty much what you're all saying. You go to your MyWAM, and there's nothing there, and but they tell you to go to the UIA site, and it tells you right there, we're in the process of getting everything worked out, and don't do anything. And so everybody, and that's what I've told people. And I don't know if they want to believe anybody or what, but I believe they'll, and we know how huge it is with all the people on unemployment and everything. And now with the fraud that's they're dealing with and all that too, who knows how long it's really going to be. So I'm just being patient. I check my MyWAM every other day or so just to see if there's a message yet. And I haven't seen anything, but I'm just going to be patient and see what happens.
Yes. And thank you. There is a huge distrust with government, and let's be honest, up front, UIA was handled very badly considering the inundation. You know, they did the best they could, but it made people wonder, like, okay, how effective is this being administered? So I try to be very understanding that people have a hard time making sure, okay, is it going to be there when I need it? So we just try to be affirming that we can help. And when it comes to government interaction, you know, government is required for a graduation requirement in high school, but often when you're a senior in high school, your priority isn't what my government is going to do for me and what I can do for my government. And so one of my priorities this year is to do some kind of a programming around civic engagement. There's some really great programs out there that are helping people build their understanding about, okay, which level of government do I go to for which questions and resources? And how do I advocate for myself when I have an issue, whether it's a program I'm you know, advocating for, a personal issue? How do I let my story help guide the decisions of decision makers? So keep an ear out, and I'd love to have you guys back to participate, and I'll see you in February.